Congenital heart disease, what you need to know for your medical school exam. Congenital heart defects are structural abnormalities of the heart that are present at birth and can affect the heart's function and blood flow. First, let's discuss the normal anatomy and function of the heart to provide a foundation for understanding these defects. The heart consists of 4 chambers, 2 atria and 2 ventricles, which are separated by valves. These valves, including the tricuspid, mitral, pulmonary, and aortic valves, ensure unidirectional blood flow through the heart. Additionally, the heart is connected to major blood vessels like the pulmonary artery and the aorta. Congenital heart defects can be classified into 2 main categories: cyanotic and acyanotic defects. The classification is based on the presence or absence of cyanosis, which is the bluish discoloration of the skin and mucous membranes due to decreased oxygen levels in the blood. Cyanotic defects result in low oxygen levels and cyanosis, while acyanotic defects do not cause cyanosis. The most common types of congenital heart defects are ventricular septal defects, atrial septal defects, coarctation of the aorta, patent ductus arteriosus, teratology of Fallot, and transposition of the great arteries. Each of these defects would take too long to explain in this video, so if you want a dedicated video to each of these, let me know in the comments. The management of congenital heart disease involves both medical and surgical interventions. Medical management focuses on medications to alleviate symptoms, prevent complications, and optimize cardiac function. Diuretics such as furosemide or Lasix or spironolactone may be prescribed to reduce fluid retention and alleviate symptoms of congestive heart failure. Angiotensin converting enzyme or ACE inhibitors like enalapril or lisinopril are used to lower blood pressure and reduce the workload of the heart. Medications like propranolol or carvedilol may be prescribed to slow down the heart rate and decrease the blood pressure and improve cardiac function. Digoxin is a medication that strengthens the heart muscle contractions and helps regulate heart rhythm. It is often used in infants with heart failure or arrhythmias. In certain cases of CHD with increased risk of blood clots, anticoagulants like warfarin or aspirin may be prescribed to prevent a clot formation. Surgical interventions including open heart surgeries, catheter-based procedures, and heart transplantations play a significant role in treatment as well. Recognizing and addressing potential complications associated with congenital heart disease is crucial. Complications such as heart failure, arrhythmias, infective endocarditis, and neurodevelopmental issues require careful monitoring and appropriate management. Individuals with congenital heart disease require long-term follow-up and management. Regular monitoring, lifestyle modifications, and preventative measures are essential for ensuring optimal outcomes and minimizing complications in these patients. What other topics should I cover next? Let me know in the comments.